Hello everyone, I'm Dr. Shantanu Tandon. I'm the Senior Consultant and Head of Department at ENT in Sakra World Hospital. Today I'll talk a little bit about the hygiene of the ear. Now, often people are concerned or they are confused about how to keep the ears clean. There are a group of patients who will come who are constantly trying to clean the ear. They're using a variety of different things and not just earbuds or Q-tips, but they're using a finger, they're using a small keychain, and invariably there is a problem because of this. Now there are two reasons they try to do that. Either they find it's itchy or they find that it is blocked. Now wax formation is something which is common for everyone, but people don't realize that the wax usually comes out by itself. In majority of the patients, we never need to really do a cleaning. But when we actively try to clean the ear, we often end up pushing the wax deeper and deeper inside. And that's the part of the ear canal which doesn't have the function to push it out. It just stays there. And over a period of time, it will form a hard ball of wax. And that's when we come across patients who will say, I can't hear properly, or it's quite painful inside. Now, when you do develop a problem such as a hard ball of wax, we will give you some drops to soften it up. Now, these drops don't pull the wax out, they soften it up such that when you come to the hospital, we are able to clean it without causing any discomfort. Now, traditionally, we used to treat these patients by washing out or doing something called a syringing of the ear. And that's still done, and it's not harmful. But sometimes if done improperly, you would find there is a little bit of trauma which can happen. And often the use of a mini vacuum machine or an ear suction microscopy, easier way or a less invasive manner of sucking out and cleaning out the ear. What I would like to stress upon is not cleaning the ear is the best way to go. And I would say nearly 99% of patients will never really have to come to the hospital for it. If you feel that there is some itching and that's it, often just moving your head to one side and pushing against the ear from outside is what would make a difference instead of just trying to itch it from inside. This will also prevent any trauma and the occurrence of something called otitis externa. And these patients who develop such infections end up requiring antibiotics, etc. So the bottom line, as far as ear cleaning is concerned, less is more. Thank you.